Good evening and open to the open evening. Welcome to the open evening at Herts Essex Fertility Centre. My name is Praveena Pai. I'm one of the consultants at the centre, so I work as a gynecologist and a fertility specialist. Today on the team, also welcoming you are two of my colleagues. I've got Mana Max, who is our marketing and wellness manager, and I've got Jackie McAdams, one of our senior fertility nurses. So I will take you through a presentation, and at this point, I would like to say last week, I think some of you had joined us, and I'm sorry that we couldn't go ahead because of sickness on one of our team members. But I will take you through the presentation in any case. We will provide a link for the virtual tour of the clinic, and you can have a look at that and visit the clinic virtually before you actually come in. There will be a question answer session going alongside, and Jackie is going to be answering those questions. So please feel free to post your questions. Okay, and we'll give a few additional minutes afterwards as well. Okay, so once again, welcome. Your microphones and cameras will be turned off. And at the end of this, we'll provide a link for a SurveyMonkey feedback. So again, I would appreciate if you could take some time and give us a feedback, because it's very important. What you tell us goes into making this better in future. Okay, so thank you, and let's get started. COVID-19 thankfully is behind us. Earlier, I used to have at least 3-4 slides dedicated to that. But at this point, I think suffice it to say that let's all still remain sensible, watch the space, take the boosters if that's what's been advised. And yeah, let's hope for a better year. So a brief history. Herts Essex Fertility was founded as the Essex Fertility Centre in 1989. As we expanded, things got busier. We moved to our current location and the present name. We've got more than 33 years of experience making babies, and we've got more than almost I would say 7,000 babies to the credit of this clinic. All procedures are performed under one roof, which is what I'm told is usually what the couples like. So you don't have to run around to different places for, say, the pharmacy or egg collection, embryo transfer. Everything is under one roof. So it is a state-of-the-art, purpose-built clinic. We provide various services. So we've got the fertility assessment. We do the IVF, ICSI, PICSI cycles, intrauterine inseminations. We offer fertility preservation in the form of semen cryopreservation, egg freezing, which is a lot in the narrative these days. We have a well-established egg donation program as well as a surrogacy program. We do offer early pregnancy scans up until 12 weeks, coupled with the Harmony test, which is now called NIPT, or the non-invasive prenatal testing. We also offer gynecological screening and a few additional treatments, which I will mention as we go along. So egg donation, why would somebody require egg donation? It could be age-related decline in egg numbers and egg quality. Somebody could have gone through early menopause. It could be chemotherapy-related decline in the egg numbers and quality. Some women are born without ovaries due to certain genetic conditions. Or it could be a part of a surrogacy arrangement whereby, let's say, we've got a same-sex male couple coming to us, they source their eggs through a donor and then transfer the embryo, which is so created, into a surrogate. Sperm donation, similarly, it could be because there is no sperm production in a male partner. This may be either because of genetic disorders, chemotherapy related, or it could be a single lady or same-sex females coming to us to use donor sperms. So what is the fertility assessment that we provide? So fertility assessment and treatment takes place over 2 visits. In the first visit, we are doing certain tests to find out about your egg reserve. This test is known as anti-Mullerian hormone, or AMH. You would have heard of this. And this tells us about someone's ovarian reserve. We also come to know about the ovarian reserve by doing a pelvic ultrasound scan and looking at the total number of follicles. We call this antral follicle count. We offer a 3D ultrasound scan and a saline infusion sonogram, by which we insert a little bit of saline into the cavity, and that contrast is able to pick up any polyps or fibroids which we don't want in the cavity, as they can come in the way of embryo implantation. HiCOSY is a test to look at tubal patency. So you would have heard of HSG perhaps on the NHS. So HiCOSY is, I would say, a slightly gentler way of doing it. So along with the pelvic ultrasound scan, we just insert a very tiny speculum, a very fine catheter, and then a bit of dye, which we can see spilling through one or both the tubes. Okay, so that is more to look at the tubal patency or tubal assessment. We offer a semen analysis as a part of this couple one-stop fertility assessment. And we also offer a different appointment called female mini fertility, in which we are just looking at the AMH and the antral follicle count and having a chat with the woman about her fertility prospects. So what do we look at when we are doing a scan? So we might find a picture like this, where we have this ovary and you see a lot of these dark circles. So these are the antral follicles. So we might find that sometimes each ovary has got maybe more than 20 follicles, and that's in keeping with, very good ovarian reserve. Okay, or we might find a picture like this, where you just about see the ovary and you might see 1 or 2 follicles. So this is somebody where the ovarian reserve clearly is less. Okay, and this you tend to see with low AMH values as well. So what happens in the consultation? So before the consultation takes place, we would have sent you the fertility consents online, which you need to log in. You need to complete these forms online. The passport needs to be uploaded, or you could give a copy to the nurse when you come at the pre-assessment, and that will be uploaded. Relevant investigations have to be done. So the consultant will have all of these bits of information ready when he or she sees you. What happens at the pre-assessment? So both the partners are invited to attend. The nurse will take certain observations. Essentially, we're going to look at your height, weight, calculate the BMI. This is where the blood tests are taken for the anti-Mullerian hormone and the thyroid function test for the female. BMI measurement happens for both, and particularly for the female, we want to underline the fact that if we have to undertake a cycle of IVF, whereby we do an egg collection under deep sedation, for us to be able to offer you that deep sedation, the anaesthetists want that BMI to be less than 34 at the start of the treatment. Semen assessment, a pot is given to the male partner to produce the sample at home, and this can be returned at a pre-arranged date and a slot. Consultation, so once we've done all these bits and bobs, all the forms have been finished, all the blood test and semen analysis report is ready, okay, and we've got all the initial information, then the consultant will send you an invite on Microsoft Teams on the day of the appointment, and sit down and go through in an hour-long sort of discussion about what are the fertility prospects and what treatments can be offered. Okay, so we have something known as salve. You may have heard of this. It's a beautiful tool which we help you download at the start of your journey. So this is like a little tool whereby you'll get your medications. So whatever is generated on our system, you can have a look at it through Salve app. It gives you little reminders about your injections. You can look at it for some robust medical information, and you can also use it as a tool for secure messaging with one of our nurse on calls if you have any burning question in the middle of the day, and if you don't think you can get to a telephone. So Salve is something which most of our patients, our couples, find extremely useful. Fit for fertility is a key element before this journey commences. So we do know that you want to keep your best foot forward, a healthy mind, a healthy body will go a long way in optimizing the results. So we will talk about it. We've got blogs written up. I'll talk about the dietitian who can help if you need any dedicated advice about it. But yes, we will, time and again remind you on how to keep yourself as fit as possible before the journey commences. Right. Then there is something known as a treatment information appointment. Let's say you've had the consultation, okay, and you want to start. One of the first things that gets booked for you is a TIA. So this again happens virtually and through Microsoft Teams. Both partners are requested to attend. You are taught about self-administration of daily injections, okay, further appointments, scans, which will all be a part of your treatment cycle, will be booked at this appointment. The nurse who sits with you during this appointment will make sure that all the relevant consent forms are signed and they're in place. This gives you an opportunity to sort of ask questions and make sure that everything is clear and you've got a vision going forward into your treatment. And yes, at this point, we also remind you that we've got 3 counseling sessions free of cost available. So if you want to utilize that before you start your treatment or at any point during the journey, after you've had the transfer, after you've had your pregnancy result, you have access to those 3 counseling sessions. So please feel free to use that. Right. A little bit more about the 3D saline infusion sonogram, which we mentioned earlier. So as a part of the fertility assessment, what we tend to do is we do an in-depth pelvic ultrasound scan, okay? And I was mentioning earlier, we put a little bit of saline, and what that does, you can see it beautifully here. When you have saline in there, any tiny polyp, which otherwise wouldn't have been seen, you can see it very nicely outlined, and this is something you want to deal with. You want this polyp removed, polypectomy done before the journey commences. And once we've done the saline infusion sonogram through the same catheter, then we put a dye, and then this dye can be seen spilling through both the tubes, and that will give us further reassurance about the tubes. Not something we necessarily do if we have decided that we are going to start an IVF cycle, but if it's just a couple coming forward to have that one-stop assessment and to understand whether can we carry on trying naturally for a bit longer, or should we jump into an IVF or an ICSI cycle. So if they decide they're going to go down the natural route, then HICOS is something we do offer. Reproductive surgery. So we do have team members, if we, let's say, find something like a polyp or a fibroid, or we find an endometriotic cyst, then we do have the ability to offer you surgeries to optimize before we start the treatment. Okay. Screening blood tests. So once we've done all the bits and bobs, the last thing we do before a treatment cycle of IVF or ICSI can begin is to do screening blood tests. And these are done for both the partners. These will include blood tests like HIV, Hep B, Hep C, chlamydia, and for the female partner, the additional AMH if it's not already been done, and a rubella and a full blood count. These results, the reason why we do them towards the end is because they must be within 3 months of starting the treatment, and they must be carried out either at our clinic or through a UCAS accredited laboratory. Okay, so let's start with some of the treatment modalities that our clinic offers. So you might have heard of the intrauterine insemination. So this is a procedure whereby the healthiest available sperm is introduced directly into the womb. IUI is used to aid pregnancy if, let's say, the male partner experiences impotence or has issues with ejaculation or erection, or if there is a female partner having issues with having comfortable intercourse. She could be having vaginismus. Sometimes we also couple it with somebody who's having ovulation induction. Let's say she's got polycystic ovarian syndrome and she's got anovulatory cycles. We can give a little bit of clomiphene citrate and then occasionally couple that with an IUI, if not with timed intercourse. It certainly is an option for single women and lesbian couples who require donor sperm, so we can give them some ovulation induction, and then once the follicle is ready, we could trigger it with an HCG injection and then use the donor sperms for IUI. What about egg freezing? So egg freezing is something which has become quite fashionable these days. It's a reproductive technique to preserve fertility. Okay, so what can be done is the frozen eggs are taken and then they're stored in liquid nitrogen. The success rates when these eggs are thawed and used to fertilize and then create embryos, the success rates are quite good. HFEA has now increased. Earlier we could store the frozen eggs to 10 years. Now the limit has increased to 55 years, which has come as a big relief for a lot of our women. The obviously, the key message I would like to deliver here about the egg freezing is you want to try and freeze eggs when you're slightly younger and not maybe when you've crossed 40, because younger eggs are better eggs. They have not accumulated DNA damage, and consequently, when they're frozen and thawed and used subsequently, they have better fertilization potential. Who uses egg freezing? So it could be social reasons, just to defer, have something in the kitty if the woman is not quite ready to start a family just yet. Or it could be somebody who has got maybe family history of early menopause, or she's been diagnosed sadly with cancer and needs to freeze her eggs before commencing chemotherapy. One of the key things we look at before we take anyone through egg freezing journey would be to look at their fertility or ovarian reserve by looking at the AMH and the antral follicle count. And yes, counseling is offered before this journey can be undertaken. Surrogacy. So surrogacy is well established in our clinic. So what happens in surrogacy when so you're basically in a surrogacy, somebody is lending the couple a womb. So when someone agrees to become pregnant and have a baby for someone else, there are two parties involved in this arrangement. So there is a surrogate, and then there are the intended parents. Okay. Often this is the only option for women unable to carry a baby to term. It could be because of a medical condition, or it could be because of a genetic condition where the woman is born without a womb. And it certainly is a condition if we have got same-sex male couples coming forward and they want to create a pregnancy. The two types of surrogacy are the full or host surrogacy and the partial or straight surrogacy, and you can read a bit more about it on our website or on the HFEA website. Right, so just to summarize, in an IVF cycle, what happens? So as I said, you've got the pre-assessment, the bloods, you then have the consultation with the consultant. Screening bloods are undertaken just before the cycle can commence. Treatment information appointment, where we sort of revise the whole plan and give you appointments for the ultrasound scans. The ultrasound scans are spaced out. So let's say the egg collection is the stimulations are happening over a period of 2 weeks. You'll have about 2 or 3 ultrasound scans around along this path to make sure that you're responding adequately. At the end of these 2 weeks, you will come for the egg collection. Once the egg collection is done, approximately 5 days down the line, you will come for the embryo transfer. That is a blastocyst transfer if all is going well. And then a couple of weeks down the line, there'll be a pregnancy test to tell us about the outcome. So let's talk a little bit more about starting the medication. So generally speaking, once a plan is ready, screening bloods are done. The first period the woman gets, we bring her in on day 2 or day 3 of the cycle. A baseline scan is done to ensure ovaries are looking nice and quiet. We don't have any ovarian cysts. Okay, and the hormonal injections commence. And these are to stimulate the ovaries to produce the maximum number of follicles they can in a safe manner. This continues throughout for a couple of weeks. And on the last scan, which is approximately 2 days prior to the egg collection, we find that if all follicles are looking nice and mature, this is when the trigger injection is given for the final burst of maturation in these follicles. What to expect? I mean, in the vast majority, women tolerate these injections quite well. These are subcutaneous injections given into the tummy, but sometimes the women may have side effects like headaches, some mood swings, a little bit of breast tenderness, engorgement, and bloating. And we do encourage, our women to drink plenty, about 1.5 to 2.5 liters every day, to try and minimize these side effects. Ultrasound scans. So as I mentioned earlier, you will have about 3 ultrasound scans as these injections are going on. The first one was a baseline scan. On the second scan, we want to see are we getting an adequate and satisfactory response. So we are looking at not just the follicular response, we are also looking at the lining, because lining is growing in response to those injections and getting ready for the embryo transfer. At the check scan, so the second scan when we bring you in, that's the day we also start another injection in the mornings called cetrotide. And the protocol that we are following is called an antagonist protocol. So the morning injection is to prevent you from ovulating prematurely. The evening injections are making those follicles grow. The morning injection is going to stop them from ovulating prematurely, because our intention is to collect these eggs and bring them out. Okay, so there'll be continuous follicular monitoring going on, and each scan will be followed by a consultation with the nurse. So you would have seen perhaps a nurse or a consultant doing the scan who would have given you a plan, and then there'll be a catch up with the nurse. So you're completely clear about what injections, when to take, and then of course it'll all come up on the Salve app. Right, so now we've reached, let's say, the final scan. As I said, the final scan will determine the date and the time of the egg collection. We will give you a trigger. Usually it's in the form of HCG, or it could be in the form of a GnRH analog. Okay, let's say the trigger is tonight at 10 p.m. Approximately 36 hours later, that will be 10 a.m. day after tomorrow morning, you will be ready for the egg collection. So we'll give you adequate instructions, both verbally as well as written. So everything is quite clear, and that kind of takes away the stress from the whole process. How do we do the egg collection? So you are requested to come in about half an hour before your appointment. You're admitted to our recovery bay. We do the baseline observations. The male partner is then taken to provide a fresh semen sample. Once the anesthetist has seen the patient, we wheel the patient inside. She's put to sleep for about half an hour. A transvaginal egg collection then happens. Once that's done, she's back in recovery, and once she's had a nice cup of tea and she's feeling well and she's passed urine, a doctor or the consultant who's done the procedure comes and has a chat with the couple, and then we allow them to go home. Okay, so generally the couples are with us for about 3 to 4 hours. So just to tell you in a slightly different form, a slightly different pictorial form on how the cycle proceeds. So let's say the woman has got her period here. Okay, we will bring her for a baseline scan on, say, day 1, day 2, or day 3. Okay, so on this scan, we will ensure that the ovaries are nice, quiet, no cysts, and we commence the hormonal injections. These hormonal injections will continue for approximately 10 to 12 days, and there will be another scan and perhaps another scan. Okay, by this scan, let's say we find everything is looking good, ready. We will give her the HCG trigger. The day after the HCG trigger is like a little free day, lots of fluid, relax, do nothing more. Okay, and then 36 hours later, we get the couple in. She will have her egg collection, semen sample will be provided, and the embryologist will get on with the process of fertilization. Okay, and once the fertilization has taken place, then somewhere along this path, maybe around day 5, there'll be embryo transfer. Okay, we'll give you adequate progesterone support, and a couple of weeks, usually about 12 days down the line, there'll be a pregnancy test. So this whole journey from here to here, you're looking at about 5.5 weeks. Okay. So what are the procedures? Like I mentioned earlier, we carry out IVF, we do ICSI, and we do PICSI. So this is in vitro fertilization, intracytoplasmic sperm injection, or physiological intracytoplasmic sperm injection. So what is IVF? I'll just tell you a little difference between these three modalities. In vitro fertilization is when the semen parameters are completely normal. What happens, all the eggs which are retrieved, each egg is then left surrounded by a few million sperms in the incubator, and then 24 hours later, the embryologist will go and have a look and see how many of these have fertilized. So there's a bit of natural selection in the process of IVF, okay? And this will depend only if all the normal parameters are met, which means we've got a good sperm concentration, good motility, okay, normal forms are meeting the criteria, and we've got a good hyaluron binding assay, which is looking at the sperm maturity. Right? What is ICSI? So ICSI stands for intracytoplasmic sperm injection, okay, whereby each mature egg is selected, a good sperm is selected, and each egg is injected with a sperm. So when does one resort to ICSI? So if there is low sperm parameters, as I said, there are strict criteria laid down by the laboratory, and if any of these criteria are not met, then ICSI is the way forward. And the reason the embryologists want to do that is because they don't want to compromise the fertilization rate. Okay. So it could be low sperm parameters, it could be no sperms in the ejaculate, and we have to do a surgical retrieval of sperms, in which case they don't have the ability to fertilize on their own and they need a hand in the form of ICSI. It could be because the semen sample is showing us anti-sperm antibodies. Again, that will compromise the ability of the sperms to fertilize on their own. Or if we've had previous fertilization failure, or some couples come to us with previous history of, having reached a stage of eggs collected, but no fertilization. In those situations, we would certainly, opt for ICSI. Right. So ICSI has been with us for 30 years. It's one of those marvels, and I think you would have certainly seen this video, but if not, just have a look. It's absolutely beautiful. So what happens here is that the embryologist, under a very fine microscope, is holding this injecting pipette. They will have a good look around and they will select a suitable sperm, which will be utilized for ICSI. Okay, so what they do is once they have earmarked the sperm, they will immobilize that sperm by making a little slash on the tail, as you can see, and then that is sucked into the pipette. Yeah, you can see that. Once that's done, we've got the egg, which is being held by the holding pipette. We've got the injection here, which has got the little sperm in there. So we stabilize that, and this is a very fine procedure. So we stabilize it, and then as you can see, this is going to inject. It goes to the zona outside, it pierces the oolemma, and then very gently, it sucks in a little bit of the cytoplasm from the egg, and then there we go. You can see beautifully the sperm has been left inside the egg. Okay, so this is ICSI. Moving on, so what is PICSI? So mature and immature sperms, they look the same. We will not be able to make out, okay? But we do know that immature sperms have got higher DNA fragmentation, they've got higher rates of abnormal chromosomal numbers, and consequently, they don't have very good fertilization potential. If we were just to do ICSI, yeah, we would not be able to understand which is an immature sperm versus a mature sperm, and hence we will be compromising the fertilization potential. So for that reason, our clinic offers a special test known as hyaluron binding assay. And if the hyaluron binding assay percentage is less, based on that value, we would recommend ICSI, and that way we will ensure that we get optimal fertilization rates. So that's something our clinic does offer. What happens? So once, let's say, the egg has fertilized either through IVF or ICSI or through PICSI, 24 hours later, when the embryologist goes in to have a look, this is a beautiful sight that that they see. So there is this. This is called the 2 pronuclear stage. You've got the nucleus from the egg, from the sperm, and that is what we expect to see at the fertilization check 24 hours after the ICSI or IVF. On day 3, the cells would have multiplied further to turn into a 6 or an 8 cell embryo. And when these are left further to develop to day 5, we get what is known as a blastocyst. Blastocyst is this little structure here. It's got a fluid-filled structure called the blastocele. Okay, and on one side, you can see this clump of cells. This is called the inner cell mass, which is going to form the baby. And around it, you can see the single layer of cells called trophoectoderm, which is going to form the placenta. So only the strongest fertilized eggs will make it to the blastocyst stage. And clearly by reaching the blastocyst stage, we are maximizing the implantation potential of this embryo. Okay, what our clinic also does is, let's say we've done a day 5 or a blastocyst transfer, but we've got a few more blastocysts left, which we don't think are suitable for freezing as spare embryos on day 5. We will let them develop till day 6. And you may sometimes find that, you know, they will reach the stage of either a hatching blastocyst or a fully hatched blastocyst. They fulfill the criteria for freezing. So if not frozen on day 5, we will again give a call to the couple and update them and tell them if they've got any spare embryos on day 6, which were suitable for freezing and have been frozen for them. So not every couple makes it to this stage. 1 in 3 couples will have spare embryos to freeze, but if that does happen in a cycle, that's like a little bonus. Okay, so come the embryo transfer day. So the day of the embryo transfer will be based on the number of fertilized eggs and the number you would like transfer. So they would, we would have had that discussion. Generally speaking, if all going well, we would want to take you to a blastocyst transfer. But if the fertilization rate is less, we also offer day 2 and day 3 transfers. Okay, the beauty about our clinic is that embryo transfers are taking place 7 days a week. So we have transfers happening on Saturdays and Sundays. So we don't want to compromise just because there is no facility. So this way we maximize your chances of pregnancy. You will have the opportunity to see the embryos on a screen before the consultant transfers it into the womb. We do an ultrasound guided transfer, and you'll also get a little picture to take away. Embryo glue is offered to all patients. So this is a little transfer medium which mimics the conditions in the female uterus. And sometimes we offer that to our couples to optimize the implantation potential, particularly if somebody's had repeat implantation failures. We have something called the IVF witness system. So we know that your gametes are precious and we don't want any mixing of any sort happening. So patients are given an ID card at the beginning of their treatment cycle. From egg collection to embryo transfer, this card remains with you. So the sperms, eggs and embryos are electronically tagged. It provides traceability of all lab procedures. So if there's any handling of any gametes, okay, or if there is a mistake, for example, it alarms. So this way we've got a system which is a very robust system of ensuring that there is no mixing or confusion happening in the laboratories. And this is in addition to the double witnessing, which happens in any case for most of the crucial steps in the lab. So this is an additional feature for everyone's peace of mind. Right, so pregnancy test done, and if you give us a ring and say it's a voila, lovely, strong, positive result, then we will see you for an early pregnancy scan, which is usually offered at about 7 weeks. What we hope to see is a beautiful pregnancy sac such as this with a lovely yolk sac and a nice fetal pole and a heartbeat in there. We offer you a picture of this. We can give you a 3D picture as well. This scan happens at 7 weeks. We can offer you an additional scan at 10 weeks, which can be coupled with NIPT, which is what I mentioned earlier. It was called the Harmony test. It is now called the non-invasive prenatal testing. This is a blood test wherein the maternal blood is taken. They look at the fetal DNA percentage in that, and then they can come up with the risk assessment for Down's screening and a couple of other aneuploidies. So this is a very precise test, about 99.9% precise, and you get the result at 10 weeks. It also has the ability to tell you the gender of the baby if you so want. So this is a facility which we do offer. Right, what about the funding options? So you know, all these years we've had NHS funding for IVF, and I know there are CCGs still trying their best to do that, but as we all know, the funding is shrinking. So one way, of course, is, you know, couples coming ahead and directly funding their cycles in our clinic, but if not, there are some other ways we can help. So our clinic does run an egg share program and a sperm share program, or whereby somebody who comes freezes and shares. What happens in this is that if a woman comes for egg sharing or a gentleman would like to do a sperm sharing, their cycle costs get subsidized significantly. Okay, so they will not be charged for their saline infusion, their screenings, their fertility drugs, and that significantly drops the cycle costs. So if any of you are interested in that, please look at our website, talk to us, and we can guide you about the details of this program. So generally speaking, fertility treatment costs in our clinic, we've given the breakdown on the website. We can send you you know, a copy if you like, but generally speaking, an IUI cycle is approximately 1,150. An IVF cycle package is 3,800, an ICSI cycle would be 5,000, and so on. You can have a look at our website. We also offer a 1 cycle versus a 3 cycle package for egg freezing. We have partnered with another body called Access Fertility, and this organization offers you packages. So what they have, and you can have a look at this and read and look at the details they have for you. So they have something called IVF Unlimited, IVF Refund, a multi-cycle package, or donor egg refund package. So if you are interested in packages, by all means, have a look at their website. And the way it works, if you decide to go with Access Fertility, they will take your medical information from us. because you would have consented for that. They will offer you the package, you make the payment to them, and that payment, remember, does not include the medication cost. So the medication cost will go to the pharmacy. Perhaps, if you're sourcing the medications from our clinic, then the medication cost goes to the pharmacy here. Okay. So wellness at Herts Essex is taken very seriously. We understand that this is a rocky road. It's a roller coaster of emotions. You've invested so much of yourself, your finances apart, but your emotions into this journey. So we have a lot of support throughout the journey. We do have a Facebook group, a patient support group, which can be accessed both by males and females. So please have a look at that and use that. And I've found, couples, patients coming back and saying they find it extremely useful to talk to someone else who's going through a similar journey. We also post a lot of supportive messages, links on our various social media platforms. So please have a look. We have a dietitian dedicated, Alex, who is very passionate about talking to you and offering you advice about modifying your diet, particularly, let's say, if somebody has got polycystic ovarian syndrome or somebody wants a bit more information on how to optimize the diet. By all means, have a look at her website. She does write a lot of lovely blogs, so have a look and give her a shout if you want to talk to her. That brings me to the end of our presentation. So why us? 33 years of experience in this journey. We've got almost 7,000 babies delivered through this process. We offer 7-day-a-week laboratory service. As I mentioned, we've got embryo transfers happening on the weekends as well. The electronic witnessing system is there for everyone's peace of mind. You will find, and this is not me saying, you can talk to others. It's a very supportive clinic. We understand, because of the ups and downs, because of the fact that success rates will not necessarily happen in the very first treatment cycle. There is a lot of support which you will find happening as you come for your scans, your transfers, your collections, or even afterwards. Okay, so this is something, yes, we take quite seriously. I think the question answers have been going on alongside, and I'm sure Jackie has been writing she's been kept quite busy. Mana would have posted a link to the feedback, so please take a few minutes and give us your feedback. As I said, it becomes very important. We will be looking at those feedbacks and putting changes and trying to improve our future open evening programs. Connect with us. We've got various social media platforms, so please join us, leave comments, talk to us. If you want to book an appointment, you've got a number provided to you. You can message us on enquiries@hertsesexfertility.com. An appointment which includes a blood test, which is AMH and thyroid function tests, a semen assessment, and a new consultation at £400. My team tells me that the new consultations at the moment should be available to you in about 5 to 6 weeks. That's the waiting time currently. Again, we would have put in a link for the virtual tour. Please feel free, have a look around, go through the virtually visit us till we actually see you in the clinic. So once again, thank you very much for joining me and my team, Marna and Jackie, for this open evening. Please go ahead, post your questions. We will continue taking your questions for another 15-20 minutes. And let's say you think of something overnight, no problems, just give us a shout tomorrow. And yeah, we can take your questions, or if you have any other doubts, queries, you want to come and pay us a visit, no problems at all. So once again, thank you and have a lovely evening. Bye.